Well, it's an exciting time because we've got two different groups meeting. We've got the Legislative Task Force that is made up of the 16 elected officials plus myself, and then we've got the Governor's Medicaid Reform Council, which is made up of a group of advisory advocacy groups from around the state. And we're talking specifically about Medicaid reform in the Governor's Advisory Council. So it's a really great moment in time for healthcare reform in the state of Arkansas because we've got these two groups made up of very committed, very intelligent, very hardworking people who are all focused on healthcare reform for the state of Arkansas. With the Legislative Task Force, we're in the process this week of selecting our official consultants. So an RFP went out a few weeks ago. We had 6 proposals come in. The elected officials on the task force voted on those 6. 4 were selected of the 6 proposals, and those 4 are going to be heard this week, and an official consultant is going to be hired sometime in the next week or 2. So those proposals are going to be vetted, and the people who gave the proposals are going to be questioned and scrutinized so that we can get the very best partner for the state of Arkansas moving forward in our healthcare task force. With the Medicaid Reform Council, what we're looking at is overall Medicaid reform. How can we make Medicaid better, make it more fiscally responsible, more flexible for the people of our state? And so we're going to be talking to the advocacy groups from around the state, people who are working in the trenches in healthcare, doing the hard work of healthcare for the people of Arkansas, to get their input in how we can make this better. Over the course of the next few months, we're going to be talking to experts who are involved on a national level in Medicaid reform. We're going to be talking to people who work with the federal government with waivers to try to develop a waiver package that can help our state move forward with Medicaid reform. And I think it's going to turn out to be a very good thing for our state. When you get that many committed people working together, sifting through all the possibilities, only good can come of that. So we're really excited, and I'm very optimistic that we're going to get the job done in the end.